Today's video, we're going over my favorite lower body plyo progressions after major lower body surgery. What's up guys, my name is Dan Pope from fitnesspainfree.com. I'm a physical therapist and strength coach. We've helped to make thousands of incredible clinicians through online courses, communities, and mentoring programs. The goal of today's video is to make you 1% better. Okay, so we all know the importance of plyometrics for return to sport for athletes. Trouble is, a very few percentage of people actually do plyometrics as part of the rehab before they get back to sport, and that's a big problem. So in today's video, I have a few goals for you. So A, I'm gonna go over my favorite plyometric exercises to help your athletes return to sport. I also wanna keep them nice and simple, so you can do these in your own clinic, and we increase these numbers so clinicians do this a little bit more, so our athletes have better outcomes. So I tend to break up my plyometrics into short ground contact time plyos and longer ground contact time plyometrics. They're exactly what they sound like. First one's gonna be a short ground contact time plyometric. We'll see how many times I mess this up during the video. Just a pogo jump. So I'm gonna have you jump up and down, nice and quick off the floor. Very short ground contact time, right? Take a breather. So these are going to have most carryover to top end sprinting, right? The other thing we're gonna talk about are these long ground contact time plyos. Let's have you do just a jump in place, loading all the way up, and then landing, right? And then take a breather. So there's a longer ground contact time here, and these generally have better carryover to agility, change of direction, pivoting, cutting, so on and so forth. So at the end of the day, we want both of these for most field athletes. But as you progress along, we can be more specific about which type of plyometrics we use for an athlete based on what sport they're trying to get back to. And we can also test them. And in a later video, I'll talk about force plate testing, and we can see where patients have deficits. Is it with short ground contact times? Is it with long ground contact times? And that'll help you with your programming for the patient moving forward. Another thing to keep in mind is that strength builds the foundation for power. If you look at studies, when athletes do strength training, it improves their power production, right? So we want to make sure that we're strengthening so we improve power, and also we want to build strength so we get athletes ready to perform plyometrics. The movements I'd like to load are going to be basic compound movements. I like to do squats, deadlifts, and then I like to hammer single-legged strength exercises. I like exercises like step-ups, lunges, single-legged deadlifts, single-legged squats, and skater squats. If your athlete can do a really good skater squat, they can probably begin doing a single-legged jump with good landing technique. All right, so first we're gonna go over jumps with a short ground contact time. And usually I'm starting with pogo jumps. The thing about pogo jumps is that they're very easy. However, if you have an athlete that hasn't left the ground in 4 to 5 months, probably going to be scared, and want to start with very low forces and work our way to high forces. So one of the things we like to start with is going to be a band-assisted pogo jump. So essentially, grab the band, pull down, it's going to assist Jacob here with his jump. Just do a nice, easy pogo jump for me. Very good. And our cues for most of these short ground contact time plyos is going to be nice and fast and snappy off the floor. If you're noticing the athlete's starting to spend a long period of time on the floor, slowing down the movement, we probably need to regress that exercise a little bit because it's too hard, or just to cue them to be faster, faster, faster. Next, we're going to progress to a regular pogo jump. Keep in mind when you're introducing plyometrics, we are not trying to build power initially. What we're trying to do is build a little bit of capacity, expose athletes to faster speeds. So we're going nice and light for these to start. So show me a good old pogo jump in place. Yep, just like that. Nice, snappy, short ground contact time. We can start to advance this by going into the frontal plane. So I'm going to have you do a wide out, in and out just like so. Very good. You can also do scissor, so forward and backwards. Excellent, you got it. Next, let's do a mogul jump, side to side. Yep, and the last one is going to be forward and backwards. Good, take a breather. Another way we can dose pogo jumps is simply by having athletes jump higher. So we can have a low height pogo jump, we do a moderate height, and we do a high height. And the high height's actually pretty dang tough, so definitely don't start your athletes there. But go ahead and show me a moderate height. Let's do about 3 to 5, 2, 3, yep. Good, take a breather. And then let's show a high height, so really going for it, right? Nice fast ground contact time. Yep, hit it and jump. Yep, and then take a breather. Yep. So despite pogo jumps being usually introductory exercises, we can spice them up really quickly. This is definitely not someone I would give to a fresh post-op patient that's just starting some of the jumping. Next, we're going to progress to single-legged pogo jumps. So we're going to have Jacob here. Just go ahead and bounce on one leg. Good. Let's do about 5 to 10. Very good. Take a breather. And just like with the other pogo jumps, we can start moving out of the sagittal plane. So let's go side to side. Yep, for a couple. Let's go forward and backwards. All right. I also like to go on a diagonal, right? So about 45 degrees. Excellent. Yep, so hitting all those different angles. Good. We can also dose the intensity of pogo jump, so a lower pogo jump, moderate or high, just with the regular pogo jump. So go ahead and show me a moderate and then show me a higher one. Yep, let's go one leg at a time for this guy. Yep, and then as high as you can get it. Boom, boom, boom. Good job, Jacob. Take a breather. And just like the double-legged pogo jumps or jumping high, this is an end-stage rehab exercise, right? So pogo jumps, typically an introductory movement. We can very easily increase the challenge, make them high intensity for end-stage rehab. You can also dose the intensity of pogo jumps via a metronome. So I have this metronome here, set to 110. I'm gonna hit the start button. Hopefully you can hear it. I'll have Jacob try to land on the tick, right? So he's trying to match up his landing and jumping with the ticks on the metronome, and then take a breather. If I want to make this a little bit harder, then I just change the metronome to make it a little slower. So essentially, Jacob now has to jump up higher so that he's in the air a little bit longer to match that metronome. So I just put it to 100. It was at 110. Give this a shot. Very good. And over the course of time, as your athletes progress, you can just progress harder and harder metronome numbers or rates, and then you get your athletes jumping higher and higher. You can also get a little bit more fancy, increase the challenge of the movement by adding a ladder. So obviously you can just jump through the ladder with one leg. You can also go sideways through the ladder. You can also do some fancier variations. So let's have you go through the ladder, but go side to side for me, Jacob. Yep, just like so. If we want to make this more challenging, we can actually have Jacob skip more rungs, which I'm not going to have you do. The next thing we can do is go forward and backwards. So same kind of idea here, except now the emphasis is more on forward and backwards movement as opposed to side. And the other thing is that you can choose exercises that are going to reflect the deficits with your athlete. So if you have post-op ACL, you make sure they get really good working in the frontal plane. If you have, say, a post-op Achilles repair, they actually have a lot more trouble in the sagittal plane. So it might need more exercises that focus on that forward to backwards motion.
Hey there, sorry to interrupt, but I've got something cool. It's an evidence-based exercise selection cheat sheet after ACL reconstruction. Sometimes it's a little bit scary working with patients after ACL reconstruction. Obviously, you don't want to hurt them, and the exercises that we choose matter. So I created a cheat sheet to help you out. It goes over which movements have the most strain on the ACL graft and how to dose those exercises from low to high. We use the evidence to guide us so you can make the right decision for your patient after ACL reconstruction. We'll also tackle that age-old question of whether or not you should be using open kinetic chain knee extensions with your patients early on after ACL reconstruction. This cheat sheet is 100% free. I'll leave a link in the show notes in the description below. Go ahead and click on that and get to learning. Now, back to your video.
We can also progress the challenge of both double leg and single legged jumps by adding a hurdle. And the hurdle is kind of nice because athletes have to jump over the hurdle. The other piece about a hurdle is that when you have a hurdle in front of you and you don't want to hit it, you're going to bring your knees up, okay? When we run, we sprint, we have to drive off a leg, and then we have to just cycle the leg through. So adding a hurdle is going to mimic that movement a little bit. So the first thing we'll do, and again, we're still working on short ground contact time jumps. We're going to have you jump over top of each hurdle, nice and quick and snappy. Bring those knees up a little bit with each jump. Very good. Yep, and then walk back to the start. If you want to get fancy, you can start working in the frontal plane. So let's have you face this way, Jacob, and then bounce through these hurdles here. Nice and quick. Yep. Explosive. Very good. Fast. And the last thing we'll try is going back and forth. So left, right, left, right, left, right. So go ahead and jump. Bounce, 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 bounce. Woo! It's tough, right? You can take a breather here, Jacob. So you can say, over the course of time, make this more challenging, by adding a hurdle, changing the direction you're going more laterally. You can even make the hurdle a little taller if you need to, or putting some more space between them as well. Towards the very end stage of rehab, I like to introduce bounding. This is generally going to be one of the toughest things you can throw at your athletes, so just proceed with caution. But the other piece is that we want to mimic those forces of them playing their sport at a high level, and these bounds definitely do that. The first is a regular bound variation. A couple cues that I like to give my athletes, nice and fast and snappy. What ends up happening is if athletes jump too far, they can't control their next jump. So when they start off, they don't jump quite so far, and over the course of time, they start jumping further and further, right? Jacob, do you mind showing me a few bounds here? 1, 2, 3, 4, 5. Yep, take a breather and walk back. The other piece is that you can do bounds for height, kind of like Jacob was showing, or bounds for distance, where you're trying to get further and further. I like to pepper in both variations. I think they're great. We can also do a bound at a 45-degree angle. So go ahead and show me those. Yep. To the side, looking very bouncy. Good job, Jacob. Come right back, right? And we can also do bounding directly to the side. So it calls a skater bound. It's just like a skater jump, except it's a lot faster with the ground reaction times. Good, and then take a breather, right? So we can progress from straight ahead and work our way into multiple planes over the course of time. And lastly, one of the most challenging things you can do with your patients is going to be a single-legged bound. So unlike a single-legged pogo jump, we're trying to recycle that leg a little bit every time we hit the ground. Nice, fast bounces. Go ahead and show me a few repetitions here, Jacob. Yep, recycle that leg through. Very good. And then come back to the start. Just keep in mind, these are very, very challenging, and I'm usually only using them at the very end stages of rehab. So we all know the importance of adding a neurocognitive demand with your patients when they're doing their rehab, and here's one of my favorites. So essentially, we're just gonna have Jacob do 60 seconds of pogo jumps, so go ahead and get started. And while he's doing this, I take my phone, Fitness Pain Free channel, give it to the patient, hit the like button as many times as you can on as many videos as possible within the 60 seconds. Make sure you repeat for a lot of sets. Good job. Next, we'll talk about jumps with a longer ground contact time. Essentially, I like to start these with snap downs. I like to start them nice and slow. So essentially, you have your athlete reach towards the ceiling in a triple extension, so up on the balls of the feet, having full extension to the knee, full extension to the hips. Now keep in mind, you can take a breather here, Jacob. So for a lot of those folks who haven't left the ground in a long time, this can be pretty scary. Sometimes I start with a really slow variation. So show me that. Go ahead and reach up towards the sky and slowly down in good landing position, then right back up again. As your athlete gets comfortable, add a little more speed. Do you mind stepping up a little bit? Yeah, you got it. So reaching up, snap down. Yep, and let's show one a little faster. Yep, full speed. Good, and then taking a breather. One of the things I also like for the start of all plyometric programs is to keep some sort of mirror in front of your athlete, or at least video them somewhat, or keep some eyes on them to make sure they're not having any weird compensations. So having things like dynamic valgus, obviously not something we want. Nothing you see with post-op knee patients, they don't like to bend at the knee. So you land with a really stiff knee and bend more of the hip. So you gotta make sure they're bending adequately at the knee. Wanna make sure we're avoiding dynamic valgus. Over time, as athletes get good, the double leg snap downs, we can progress to a single legged snap down. So essentially, let's have you balance on one leg here, Jacob. Reach up towards the ceiling, up on the ball of the foot, slap down slowly. Very good, coming up again. And as your athlete gets comfortable, we just speed it up. Show me a full speed one. Very good. Yep. So we go from building confidence, building a little bit of capacity, and over the course of time, we're actually working on building speed. After your athletes are comfortable with the snap down, usually we go to a box jump. The reason why we do a box jump and not a regular jump in place is that when you do a box jump, you jump to a height. And normally what happens when you jump just on the ground and back down to the ground is that as you approach the ground, you build up speed. So in a box jump, that doesn't happen because you're jumping and landing on a higher height, right? So it actually makes it a little bit easier than jumping up and down on the ground. I also like to split apart the jump and the landing. And this is really nice because we can work on our jumping and landing biomechanics. Usually I have a mirror right here so Jacob can see what's going on, and also giving him cues to make sure his technique is good, right? So when we start this box jump, same as the snap down. Arms up into the air, yep, snap down and then jump. Nice soft landing. And then from here, step off the edge, same kind of deal, land with the arms back. One of my cues I like from the landing perspective is to land like you're about to jump again. So we get the arms in the right position, but really we just stand up and walk and do another repetition, right? Just like with the other jump variations, we're gonna start with the double-legged variation, and over the course of time, we progress to a single leg. It's also very easy to enhance the challenge or increase the challenge just by increasing the height of the box jump. Just make sure your jumping and landing technique is good before you start to ramp up. Next, we can progress to either jumping in place or we can start jumping over top of hurdles, right? So unlike the short ground contact time jumps, we want a longer ground contact time. So what that means is that when you're landing, you're able to load up, get into deeper degrees of knee bending, hip bending, so on and so forth. I also like to start these with the stick. So essentially, athlete's gonna jump over the hurdle and stick the landing, and then reset, and then jump again. Jacob, you mind showing me that? Start nice and tall. Yep, jumping, arms back when you land, reset, arms to ceiling. Yep, big jump. Yep, let's go back to the start. Excellent. So that looked great, Jacob. And you can also do these jumps laterally, just like we showed previously. You can go forward and backwards. You can also go side to side. There's a lot of variations you can use. Once athletes are doing really well with this variation, you usually take away the stick and just make the jump continuous, right? So let's go ahead and have you do 3 jumps here. Yep, yep. That's all right, let's come back. And here's the thing, this is more of a longer ground contact time jump. So honestly, I'd like to have you spend a little more time, load up a little bit deeper for these guys, all right? So go ahead and show me a jump here, jump nice and tall, load up, yep, load up. There you go, right? So unlike that short ground contact time, we're actually taking a little more time on the ground. We're loading up, we're getting a little deeper so we can produce some more power, right? Now we want to eventually do jumps with one leg as well. So what we'll do with Jacob here is we'll have him do a jump over the hurdle, stick the landing, stand up, and go again. So go ahead and show me that there, Jacob. Big jump, nice soft landing. Yep, great stick. Let's go ahead again. Nice, awesome, great work. And then over the course of time, we can make these continuous just like we would with the double-legged jumps. One of the things I eventually like to add a lot is jumping in the transverse plane. So essentially you're gonna be jumping up and turning. One thing to think about is if you're jumping and turning, when you land, your knee wants to go into dynamic valgus, right? So we're basically teaching athletes how to control those motions, which oftentimes are the same motions that got them hurt in the first place. So a really good exercise, but proceed with caution with these, right? So the first one I like to do is a double-legged jump. We're gonna have you turn 90 degrees, stick that landing, reset, jump, turn 90 degrees, all right? Show me a few of those. Yep, same jumping mechanics, same landing mechanics, yep. And back, awesome, yep. Your athlete's doing really good at this. This is really tough. We can add a hurdle. I'm gonna have you do a 180-degree turn. So basically always facing the hurdle when you land. All right, you ready for that? Big jump, turn 180. Yep, and when you turn back, turn the opposite direction. So you're facing this way when you jump. Good, and stick that landing. Yep, take a breather. So Jacob's making this look really easy. They're actually quite challenging, right? But a good exercise. We can make these more challenging by doing this on one leg. This is one of my favorite exercises here. So what we're gonna do is a single-legged jump with a 90-degree turn. Same as we did with 2 legs, but now with 1 leg. Yep, go ahead and give it a jump. Good, stick that landing. Yep, jump, turn. Great job, take a breather. So the thing is, you can do this right in place. Sometimes I'll actually have athletes try to maintain their stance on one spot, kind of working on accuracy, or you can have them move, kind of like Jacob was doing. Just keep in mind, challenging exercise. When you're jumping towards the inside, the knee's gonna wanna come in, so athletes have to be able to learn how to stay lined up well. Great exercise. Broad jumps, so pretty similar mechanics as all the other jumps, except now the goal is to cover more ground as opposed to going up, right? So show me one broad jump where you stick and then walk back to the start. Good, yep, big jump, nice landing mechanics, and walk back to the start. So if athletes are doing really well here, we can progress to a continuous jump. Show me 2 in a row and stick on the last jump. Good, big jump, load up, good, very good. And just keep in mind, these are long ground contact time jumps, so feel free to really load up in the center, get some more knee flexion than you might normally get with the short ground contact times. Over the course of time, as your athlete's doing really well, we can now do a single-legged broad jump. So show me one of those, and make sure you stick that landing. Good, nice jump, and land, yep. One of the reasons I like the single-legged broad jump as well is because eventually athletes are going to be tested during this, right? A lot of our hop tests are basically single-legged broad jumps, or you're doing multiple hops back to back. So they're practicing the thing that's probably important for them, although we don't want to just practice a test so that people can pass. We want to make sure they jump with a lot of different jump variations well, and they can pass the test as a result of that. Another great jump variation, and they're kind of like the bounds sister or brother. So it's going to be a long ground contact version of those jumps. Are going to be skater jumps. So largely, we get some time to really kind of load up the lower body. What I like to give cue-wise to my athletes is think about taking this outside leg behind your body so you can throw it out to gain as much ground as you possibly can. Stick the lane on the other side and then jump in the same way back. You mind showing 1 or 2 jumps for me? Good, throw the leg out, soft landing, and go ahead, same thing back. Yep. And Jacob over here, he's doing more of a vertical jump. You can do these jumps more vertically, or you can also do them a little bit more for covering ground, right? Choice is up to you, okay? We can also do these at a 45-degree angle. So show me a few of these with a stick. Big jump, 45, stick the landing. Good, 1 more, very good. And then coming back to where you started. Last thing we can do is we incorporate a quarter turn. So this is pretty nice. If you think about, let's say, a baseball pitcher, they have to be able to push off the backside leg and also rotate. And this jump actually mimics that, so it's one of my favorites for those folks, right? The other piece is when Jacob lands, he's landing facing forward, and he has to basically be able to decelerate so he lands well. And that's usually really tough for patients that have knee pain, post-op ACL reconstruction. There's a lot of good stuff going on with this jump. Do you mind showing 1 or 2 of these here, Jacob? Yep, loading up, big jump, quarter turn. Yep, soft landing, going back to the start. Try to get out a little further if you can. Big jump, quarter turn, nice landing. Good. All right, thank you, Jacob. Good work. All right, so I want to wrap things up a little bit. Generally speaking, we are incorporating long ground contact time plyos and short ground contact time plyos at the same time. Just we start with very easy variations and progress over the course of time to harder variations. Usually we're starting with 2 legs and we progress to 1 leg. We're starting with low intent, more building capacity, to higher intent, where really actually are producing power. And usually, a lot of these jump variations are going to be advanced in parallel with strength training and eventually some sort of running program, as well as a change of direction or agility program. And if you want to learn more about how I incorporate those, I have a video for you. I'll leave a link in the corner. Go ahead and click on that. I'll go over a master course for return to sport, focusing on sprinting, acceleration, change of direction mechanics, all that good stuff. Click on that link and I'll see you there.